On-screen text. Indiana University. Improving nursing education through virtual reality. Shannon Love. Clinical Assistant Professor and Simulation Center Director. IUPUC.
We've been wanting to do virtual reality here at IUPUC for a lot of reasons, but flexibility being one of them. So the equipment is SimX AR.
In a classroom lab, she holds a pair of virtual reality goggles to her face.
So it is a company out of California that does virtual reality programming for health professions.
An animated simulation of a hospital room with a woman and a baby. Braylon Evans. Second-year nursing student. IUPUC.
It's very accurate because I work in a hospital, and when we have C. diff patients, the isolation, you have to practice putting on the gown, the gloves, washing the hands properly.
Braylon wears the goggles and holds simulators in each hand.
Did my test results come back? I'm having all this diarrhea.
Well, you actually have a condition that's called C. diff, so it actually makes you have diarrhea there for a while.
Mackenzie Holtz. Second-year nursing student. IUPUC.
I like the aspect that you're communicating with the patient and the family members because that's real life.
She wears the virtual reality equipment. The two handheld simulators become gloves in the animated view. She is able to pick up items. She talks to the woman and examines the baby in the simulation.
So what medications were you on during the pregnancy?
I used pills about a week ago.
What pills were they? Do you know the exact name of the medication?
I'd rather not say.
Oh, okay.
I take pain medication.
Unfortunately, we do see commonly, and a lot across the country we do, but we do see a lot of that here in our region. And so that is babies born to a mother that took various types of drugs and might have some withdrawal symptoms. The purpose of that scenario is not so much around the baby, but more around the mother and how they talk with the mother.
I feel terrible.
I'm sorry you feel that way. The only part we're concerned about is her fussiness and stuff, so we're just going to have to monitor her through the withdrawal stages and make sure everything stays on track, but as far as we're concerned, she looks like a healthy baby.
Well, actual clinical exposure, live clinical exposure is fantastic. We can't create a situation. So that is the big value, is the flexibility. UITS really got this off the ground for us. So Bill Fields, our executive director, was the kind of startup communication with this company, and they've been really instrumental helping us have the equipment that we need.
On-screen text. UITS University Information Technology Services. Copyright 2019, the Trustees of Indiana University.